Hi everyone, welcome back to my YouTube channel and today we are going to talk about angina pectoris. So let's start our topic with introduction. Human heart requires a constant supply of oxygen-rich blood to function effectively. When the supply of blood to the heart muscle is reduced, the heart does not receive enough oxygen, leading to a condition that is known as angina pectoris. It is one of the most common symptoms of coronary artery disease and is often described as warning sign of an impending heart attack. Definition of angina pectoris. Angina pectoris is a clinical syndrome that is characterized by chest pain, discomfort, or pressure that occurs when the oxygen demand of heart muscle exceeds its supply. It is usually due to reduced blood flow through the coronary artery. Causes of angina pectoris include coronary artery disease, that is, narrowing or blockage of coronary artery due to atherosclerosis, that is, plaque buildup. Second cause may be coronary artery spasm. It is the sudden tightening of the muscle in the artery wall, as you can see in the last diagram in this area in the side. Third cause of the angina pectoris is increased oxygen demand. It is during exercise, stress, heavy meal, alcohol exposure can cause angina pectoris. Fourth cause is risk factors that include hypertension. In case of hypertension, the risk of angina pectoris increase. In case of diabetes, the risk of angina pectoris increase. In case of obesity, smoking, high cholesterol, or sedentary lifestyle, angina pectoris is increase. Types of angina pectoris. Types include stable angina, unstable angina, variant angina that is also called as Prince-Mettels angina, and microvascular angina. Now let's talk about these types of angina pectoris one by one. So first type of angina pectoris is stable angina. It is most common type of angina pectoris. It is triggered by physical exertion, stress, or heavy meals. It is relieved by rest or medications like nitroglycerin. Next type of angina pectoris is unstable angina. It occurs unpredictably even at rest. It is more severe and long lasting than stable angina. It is considered as a medical emergency as it may precede a heart attack. Next type is venous angina that is also called as Prince-Mettels angina. It is caused by spasm of coronary artery and it often occurs at night or early morning. It is relieved by medication but may lead to complications. Next type of angina pectoris is microvascular angina. It involves dysfunction of small coronary artery. It is more common in women and its pain may last longer than other types of angina pectoris. Now let's talk about symptoms of angina pectoris. First, there is chest pain and discomfort that is described as a pressure, feeling, heaviness, feeling, or tightness or burning sensation. Second symptom is pain radiation, as the pain of angina pectoris may spread to shoulders, arms, neck, jaw, or back, especially at the left arm area. Third symptom is shortness of breath. Fourth is sweating and fatigue in case of angina pectoris. Fifth is nausea or dizziness that occur in some cases. And now let's talk about diagnosis of angina pectoris. First, it includes medical history and physical examination. Second, we can do is electrocardiogram to detect changes in heart rhythm. Third, in diagnosis, we can do is echocardiography, that is to study heart structure and function. Fourth, we can do is exercise stress test, and this is to observe heart function during exertion. Fifth, we can also do is coronary angiography, that is to detect blockages in coronary arteries. And sixth, we can also do blood tests, that is to check for risk factors like cholesterol and diabetes. Treatment of angina pectoris include lifestyle modification, medication, and surgical or interventional procedures. First treatment path is lifestyle modification in case of angina pectoris. And it includes healthy diet that is low fat, that has low cholesterol, and it is rich in fruits and vegetables. It also includes regular exercise under medical guidance. Third, in lifestyle modification, it is required to quit smoking and alcohol. And then fourth is the stress management that is also required in case of lifestyle modification to avoid angina pectoris. Next type of treatment is medication that is done for angina pectoris, and it includes nitrates like nitroglycerin, that is to relieve chest pain by dilating blood vessels. We can also use beta blockers that are to reduce heart rate and thus increase the oxygen demand. Thus maintain the oxygen demand. Third, we can also give is calcium channel blockers that relax blood vessels and reduce spasm chances of the vessel. Fourth, we can also do is antiplatelet drugs that in like aspirin that is to prevent clot formation. Note the type of medication used in case of angina pectoris depend on the type of angina pectoris or the cause factors of angina pectoris. Fifth, we can also do statins that are to lower cholesterol level and that also help in angina pectoris. Next type of treatment in case of angina pectoris is surgical or interventional procedures that include angioplasty and stent placement that opens narrowed artery. Second, we can do is coronary artery bypass grafting that restore blood flow by bypassing blocked arteries. Now let's talk about complications of angina pectoris. It can cause myocardial infarction, that is heart attack. Angina pectoris can cause heart failure, arrhythmias, that is irregular heartbeat. It can cause sudden cardiac death in case of severe untreated cases. Conclusion of this lecture video. Angina pectoris is not a disease by itself, but a symptom of underlying coronary artery disease. It serves as an important warning sign that the heart is not receiving enough oxygen. Early diagnosis, proper treatment, and lifestyle changes can prevent complications like heart attack and improve the quality of life. Awareness about angina is crucial for reducing the global burden of cardiovascular diseases. And this was all about angina pectoris. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.